Welcome to today's HealthLine webinar from the American Association of Kidney Patients, titled A Treatment Specifically Designed for IgA Nephropathy, an AAKP HealthLine Innovator webinar sponsored by Calliditas Therapeutics. My name is Erin, and I am AAKP's Director of Patient Insights, Data Analytics, and Advocacy. I oversee our patient research and education activities, as well as our grassroots engagement activities such as our Ambassador Initiative, which falls under our Center for Patient Engagement and Advocacy. AAKP's HealthLine webinars fall under our Center for Patient Research and Education. We believe patient and caregiver education is an integral part of treatment and protection of patient lives, and we work to ensure that the patient has a central role in research and guidance that are designed to determine optimal approaches and strategies for providing healthcare services, assistance programs, and access to new products and services. We built this center with the latest polling and engagement technologies to ensure that kidney patients take a central role in informing the federal, academic, and private sector research, shaping the next generation of healthcare services, assistance programs, and innovative new treatments. And we encourage you to respond to our flash surveys and other engagement opportunities that you receive via email. AAKP is pleased to launch our Innovator webinar series, an extension of our normal HealthLine webinar programming. The content of this program as presented and financial support of this webinar was provided by Calliditas Therapeutics. As the oldest and largest patient-led kidney patient organization in the U.S., AAKP is proud to host this Innovator webinar as a service to the expanding national and global communities of patient consumers and their families, medical practitioners, researchers and policymakers following innovation and advancements in kidney care and treatment. AAKP is an aggressive supporter of innovation to change status quo care. While this activity is an approved educational webinar, AAKP does not endorse this webinar nor endorse or promote any specific commercial entities or products. Thank you again to Calliditas Therapeutics for sponsoring this webinar. With that, let's get started. I'd like to introduce our guest speaker, Dr. Jonathan Barratt. Dr. Barratt leads the Renal Research Group within the College of Life Sciences, University of Leicester. He is chief investigator for a number of international randomized controlled phase 2 and 3 clinical trials in IgA nephropathy and was a member of the FDA and American Society of Nephrology Kidney Health Initiative, identifying surrogate endpoints for clinical trials in IgA nephropathy workgroup. We are so pleased to have Dr. Barratt here today, and I now turn things over to him to start the presentation.
Welcome, everyone. I'm Professor Jonathan Barratt from the University of Leicester in the United Kingdom, and it's a real pleasure to join you today to talk about IgA nephropathy and to discuss a therapy that is available for patients with IgA nephropathy in the United States. First of all, I'd just like to read the disclaimer and to say the views and opinions expressed in the following PowerPoint slides are those of the individual presenter and should not be attributed to the American Association of Kidney Patients, AAKP, its directors, officers, employees, volunteers, or members. So let's now move on to our presentation. And this presentation is entitled A Treatment Specifically Designed for IgA Nephropathy. In today's presentation, we're going to cover three main topics. First, we'll review the current understanding of IgA nephropathy. We'll then review study results from a treatment designed specifically for people with IgA nephropathy. And finally, we'll also talk about some additional resources that are available to you. So first of all, understanding IgA nephropathy. What is IgA nephropathy? Well, IgA nephropathy, or IgAN, is an autoimmune disease that affects the kidneys. An autoimmune disease is a disease where the body's own immune system is attacking itself. And in the case of IgA nephropathy, the body's immune system is actually attacking the IgA protein itself. IgA nephropathy occurs when there are increased levels of IgA1 in the blood, and the body produces antibodies to these IgA1 proteins. These antibodies combine with the IgA1 molecules to produce complexes, large aggregations of proteins that can become deposited in the fine filters of the kidneys. When these deposits accumulate within the filters of the kidneys can become inflamed, and this inflammation can lead to irreversible kidney damage and loss of kidney function. So what may cause IgA nephropathy? Well, I think it's best to think about, where does this IgA come from that we have this autoimmune response to? And actually, there is a lot of data suggesting that the IgA that we see that's deposited within these fine filters of the kidneys actually comes from the immune system that lines our gut. We know that the IgA1 it looks very similar in terms of its structure, in terms of how we can see it in the laboratory. And we know that the type of IgA that's produced typically in the gut is at higher levels in the bloodstream in patients with IgA nephropathy. And it's this IgA that is in the bloodstream that ultimately forms these big aggregates of proteins that is eventually deposit within the filters of the kidneys. And as I've said before, this accumulation of this IgA1 protein can trigger inflammation in those filters and damage and loss of function of those filters, which ultimately leads to kidney failure. So how common is IgA nephropathy? Well, IgA nephropathy is more common among certain groups and individuals. It's more common in people of Asian ancestry, it's common in Caucasian patients, but it's less common in people of African descent. Many people are diagnosed in their late teens to 30s, so it's a disease that affects young adults. And unfortunately, many people with IgA nephropathy progress over a number of years to develop kidney failure, meaning that they require dialysis or a kidney transplant to continue with their life. What are the potential signs and symptoms of IgA nephropathy? Well, IgA nephropathy is often asymptomatic in its early stages, and that's a real challenge for us as doctors, because we often don't pick up the disease as early as we would like. Patients may notice that they suffer from low back pain, particularly brought on by coughs and colds. They may see blood in the urine, and it may look fresh red, like you would see if you cut your skin, or it could look like Coca-Cola or tea coloured, so a dark brown colour. If there's lots of protein in the urine can have a very foamy appearance, and that's particularly noticeable after you've passed urine in the toilet, where there's a big foam like that you see on the top of a beer that might appear in the toilet bowl. And some patients may notice swelling in the feet, the ankles, or the legs. In many cases, the symptoms are subtle. A lot of patients won't actually experience any of these, and the diagnosis is actually a by chance diagnosis because the patient has had their urine dipsticked, or they've had their blood pressure measured, or had a blood test for some other reason. And excess protein or even blood in the urine may not be discovered until you actually have your urine dipsticked. So you may not notice anything yourself. It may only become apparent when your urine is evaluated by a doctor. So how do we diagnose IgA nephropathy? Well, to diagnose IgA nephropathy, we need to do a kidney biopsy. And this is where a small piece of kidney tissue is taken under a local anaesthetic, usually by either a nephrologist, a kidney doctor, or a radiologist. And that piece of kidney tissue is looked at under the microscope in a pathology lab. A kidney biopsy is always performed in the hospital. You may or may not have some slight sedation, but normally when you have this biopsy, you're able to go home the same day, and your result will be available within 2 weeks after the biopsy has been performed. When we look at the biopsy down the microscope, we'll see these IgA deposits in the fine filters or glomeruli of the kidneys. We'll also be able to look for signs of inflammation and scarring that help us decide how advanced the disease is. The biopsy may also help us decide whether there's any particular treatments that might be needed, and that's very much determined by how much inflammation there is in association with these IgA deposits. By the time IgA nephropathy is diagnosed, some kidney damage may have already occurred, and that's because you may well have had the disease for a little period of time, and because it wasn't causing you any symptoms, it's grumbled on in the background before you've come to medical attention, and therefore the kidney has accumulated a certain degree of damage ahead of us making that diagnosis. So how do we manage IgA nephropathy? Well, at the moment, unfortunately, there is no cure for IgA nephropathy, and so the management we institute in all our patients is focused on controlling the factors we know that increase the rate of loss of kidney function. And so these approaches are commonly used across all forms of kidney disease, and they include limiting the amount of sodium in the diet, because high levels of salt in the diet will increase your blood pressure, and we know a high blood pressure can damage kidney function. We also know that damaged kidneys raise your blood pressure. So you can end up in this vicious cycle of kidney damage causing high blood pressure causing more kidney damage, and this goes on and on and on, making the situation worse. So our focus is very much on trying to control blood pressure. One of the ways we can do that is by limiting dietary salt intake. We can improve exercise. We can try and attain a satisfactory weight. All of these things will help. We know that patients with kidney disease are at risk of heart disease, and therefore we want to make sure that patients have a diet that is low in saturated fat and cholesterol to try and have as heart healthy a diet as possible. But other than controlling blood pressure and these simple dietary modifications that we should be using for all patients with kidney disease, we haven't had any disease-specific treatment options until recently. So how do we monitor patients with IgA nephropathy? Well, once we've made a diagnosis, we want to keep monitoring that patient to look for signs of deterioration in the kidney function, but also to determine whether there's a high risk that kidney function may deteriorate in the future. And so the two things that we do routinely as kidney doctors or nephrologists is we look at how much protein there is in the urine, and we look at your kidney function by measuring a blood test that measures serum creatinine. And using that blood test value, we can calculate something called the eGFR, or the estimated glomerular filtration rate, which is how we assess the level of kidney function. And I'm sure all of you will have had these measured, and these will be part and parcel of your ongoing care by your kidney doctor. So what I want to move on to now is to talk to you a little bit about a treatment that's been specifically designed for people with IgA nephropathy. And this treatment is called Tarpeyo. And today we're going to review Tarpeyo, the first and only treatment specifically designed for and studied in IgA nephropathy, which has FDA approval that was approved in December 2021. Tarpeyo is a prescription medication used to reduce levels of protein in the urine, and what I've said is known as proteinuria. It's used to treat adults with IgA nephropathy who are at high risk of disease progression. It is not known if Tarpeyo is safe and effective in children. This approval is based on reduction in proteinuria. Confirmatory clinical trial results are needed to verify the clinical benefit of slowing kidney function decline. There is important safety information throughout this presentation that I will review, but you can also go to tarpeyo.com to see the full patient prescribing information, which will go through key safety information such as who should not take Tarpeyo, and particularly not to take Tarpeyo if you are allergic to budesonide or any of the ingredients in Tarpeyo. And I'd like you to see the end of the patient information for a complete list of ingredients in Tarpeyo. Part of what makes Tarpeyo unique is the way the capsule is designed. The Tarpeyo capsule was specifically designed with targeted release technology to deliver treatment to an area of the gut thought to play an important role in IgA nephropathy. It has not been established to what extent the efficacy of Tarpeyo is derived from a local effect in the gut versus a systemic effect, i.e. an effect where the drug is absorbed into the circulation. If we think about the gut in a little bit more detail, the types of cells in the gut that produce the IgA1 concentrated within certain areas of the immune system called Peyer's patches. And these Peyer's patches are heavily concentrated in a certain part of the small intestine. And Tarpeyo has been specifically designed to target these areas of the immune system to reduce the amount of IgA antibody that is released from the gut into the circulation. So if we now look at the image in front of you of the capsule here, you can see that Tarpeyo is made up of the active ingredient budesonide, and the unique target release technology of the capsule helps deliver the active ingredient to the area of the gut thought to play a role in IgA nephropathy, which is indicated by the line. The Tarpeyo capsule was designed to deliver treatment to this area in a controlled rate of release of the active ingredient budesonide. Once dissolved in the gut, the coated beads control the rate of release of the active ingredient in this area of the gut, essentially delivering a local treatment to the part of the gut that we believe is responsible for generating that IgA that produces these protein complexes that deposit in the filters. So how was TARPEO studied? Well, TARPEO was specifically studied in a large trial of patients with IgA nephropathy. And this trial comprises two parts, and what I'm going to focus on is Part A. Part A of the clinical study was the pivotal placebo-controlled efficacy and safety trial, and this was the data that was generated that served as the basis for the FDA approval. And so in this Part A of the study, data was compared between 97 patients who received TARPEO plus standard of care blood pressure treatment, and compared against 102 patients with IgA nephropathy who received a placebo, but did also receive that standard of care blood pressure treatment. The primary objective of the study was to look at how TARPEO reduced the high levels of protein in the urine after 9 months of treatment, as measured by the urine protein to creatinine ratio. And so that's the way that we assess the amount of protein in the urine in standard clinical practice. In Part B of the study, this is a more longer-term study which will look at a larger number of patients and will actually look at the changes in kidney function, or the eGFR, over 2 years for all patients in the study. And that data will become available at some point in the near future. So what did the study show? Well, the study showed that TARPEO significantly lowered levels of protein in the urine at 9 months. So in Part A of the study, patients who received TARPEO plus the standard of care blood pressure medication showed a 34% reduction in the levels of protein in the urine. And that's compared to patients who received blood pressure medication only, who showed only a 5% reduction in levels of protein in the urine. And this means that there was a reduction of 6 times the amount of protein in the urine with TARPEO plus blood pressure medications compared to patients who were just given the placebo and the standard blood pressure treatment. The clinical study also looked at eGFR, or estimated glomerular filtration rate, at 9 months. And remember that eGFR is a key measure of kidney health, not only in IgA nephropathy, but in all forms of kidney disease. Patients taking TARPEO plus standard of care blood pressure treatment showed a mean absolute change of minus 0.6 mils per minute per 1.73 meters squared in eGFR from baseline versus a change of 4 mils per minute per 1.73 meters squared with blood pressure medication alone at 9 months. The impact of TARPEO on eGFR is being followed in Part B of the study. It has not been established whether TARPEO has demonstrated a benefit in slowing kidney function decline in patients with IgA nephropathy. So if we now move focus to TARPEO's safety profile. So TARPEO may cause serious side effects, and these might include effects of having too much corticosteroid medicine in your bloodstream, hypercorticism, adrenal suppression, and risk of immunosuppression. I'll continue to review more important safety information later in this presentation. So if we look at the safety profile of TARPEO in a little bit more detail, you can see that during the clinical trial with TARPEO, what you see on your screen were the most commonly reported side effects. These are not all the possible side effects of TARPEO, and I would advise you to call your doctor for medical advice about potential side effects. Approximately 9 in 10 patients in the clinical study stayed on TARPEO treatment. You may report side effects to the FDA at 1-800-FDA-1088. What do you need to know about TARPEO? Well, TARPEO is an oral medication. It's taken once daily in the morning. Dosing consists of 4 capsules of TARPEO taken once a day and swallowed whole. As I've said, it should be taken in the morning, at least 1 hour before a meal. Capsules should not be opened, crushed, or chewed. And it's important to avoid eating grapefruit and drinking grapefruit juice while you are being treated with TARPEO. Before taking TARPEO, please tell your healthcare provider about all of your medical conditions. Next, we'll talk about the TARPEO Touchpoints program. TARPEO Touchpoints offers services, assistance, and resources to help you access TARPEO as easily as possible. If you and your doctor determine that Tarpeyo is right for you, your doctor will need to fill out an enrolment form. Once your enrolment form is received and processed by Tarpeyo Touchpoints, they will reach out to you and start to help you along your treatment journey. Let's look at the services and support that Tarpeyo Touchpoints offers. There is a Tarpeyo Touchpoints team that provides support with enrolment and follows up with you as you continue therapy. Tarpeyo Touchpoints also helps you explore financial support options that are available for eligible patients. Tarpeyo Touchpoints also arranges to have Tarpeyo delivered right to your doorstep. Additional resources are also available. Once you receive Tarpeyo delivery, a Tarpeyo Touchpoints Care Navigator will follow up regularly to discuss medication routines, side effects, lifestyle and dietary considerations, and on-time medication refills. Tarpeyo Touchpoints has financial support programs that can help you reduce or eliminate out-of-pocket costs. With the Tarpeyo Touchpoints Copay Assistance Program, eligible commercially insured patients can pay as little as $0 per prescription. For patients who are uninsured or underinsured, Tarpeyo Touchpoints Patient Assistance Program can help eligible patients to receive Tarpeyo at no cost. Once your doctor has prescribed Tarpeyo, it's directly delivered to your doorstep. Tarpeyo is shipped to you from an exclusive specialty pharmacy called Biologics. Tarpeyo is not available at any other pharmacy. You provide Biologics with your email, which will allow you to receive tracking information. Tarpeyo will be shipped, as I've said, directly to your doorstep for ease. A Tarpeyo Touchpoints nurse educator will check in with you 14 days after the first shipment. And for future shipments, you can sign up for refill notifications by text message, or Biologics will contact you 7 to 10 days before your next refill to schedule a delivery. So now I just want to run through some important indication and safety information. So I've already described to you what Tarpeyo is, but just to run through that again, Tarpeyo or budesonide delayed release capsules is a prescription medicine used to reduce levels of protein in the urine in adults with IgA nephropathy who are at high risk of disease progression. It is not known if Tarpeyo is safe and effective in children. The approval of Tarpeyo is based on reduction in proteinuria. Confirmatory clinical trial results are needed to verify the clinical benefit of slowing kidney function decline. Now let's review the full important safety information, covering who should not take Tarpeyo, and particularly that you should not take Tarpeyo if you are known to be allergic to budesonide or any of the ingredients in Tarpeyo. And you can find a complete list of ingredients in Tarpeyo at the end of the patient information leaflet. So before taking Tarpeyo, remember to tell your healthcare provider about all of your medical conditions, including any of the conditions on this slide. I'm not going to read through them all, but it's important that you do make note of a number of these and that you inform your healthcare provider, because it will be important to help them decide the best treatment for you. When you tell your healthcare provider about all the medicines you take, please remember to include prescription and over-the-counter medicines, vitamins, and herbal supplements. Tarpeyo and other medicines may affect each other, causing side effects. Just again to remember to run through how you should take the Tarpeyo medication. You should take Tarpeyo exactly as your healthcare provider tells you. Your healthcare provider will decide how long you should take Tarpeyo for. Do not stop taking Tarpeyo without first talking with your healthcare provider. Take your prescribed dose of Tarpeyo one time each day in the morning, at least 1 hour before a meal. Take Tarpeyo capsules whole. Do not open, chew, crush, or break Tarpeyo capsules before swallowing. If you miss a dose of Tarpeyo, take your prescribed dose at your next scheduled time. Do not take 2 doses of Tarpeyo at the same time. And if you take too much Tarpeyo, call your healthcare provider right away or go to the nearest hospital emergency room. What should I avoid while taking Tarpeyo? Well, do not eat grapefruit or drink grapefruit juice during your treatment with Tarpeyo. Eating grapefruit or drinking grapefruit juice can increase the level of Tarpeyo in your bloodstream. What are the possible side effects of Tarpeyo you need to be aware of? Well, Tarpeyo may cause serious side effects, including effects of having too much corticosteroid medicine in your bloodstream. This is known as hypercorticism. Long-time use of Tarpeyo can cause you to have signs and symptoms of too much cortisol, a stress hormone in your blood. Tell your healthcare provider if you have any of the following signs and symptoms of hypercortisolism: acne, you're bruising easily, you have a rounding of your face, ankle swelling, thicker or more hair on your body and face, a fatty pad or hump between your shoulders, or pink or purple stretch marks on the skin of your abdomen, thighs, breasts, or arms. We also need to be aware of adrenal suppression. So when Tarpeyo is taken for a long period of time, adrenal suppression can happen. This is a condition in which the adrenal glands do not make enough steroid hormones. And symptoms of adrenal suppression include tiredness, weakness, nausea and vomiting, and a low blood pressure. Tell your healthcare provider if you are under stress or have any symptoms of adrenal suppression during treatment with Tarpeyo. You also need to be aware of the risk of immunosuppression. Tarpeyo weakens your immune system, and taking medicines that weaken your immune system makes you more likely to get infections. So avoid contact with people who have contagious diseases, such as chickenpox or measles, during treatment with Tarpeyo. Tell your healthcare provider right away if you come into contact with anyone who has chickenpox or measles. Consult with your healthcare provider regarding appropriate vaccination scheduling. And importantly, tell your healthcare provider if you develop any symptoms of infection during treatment with Tarpeyo, including fever, feeling tired, chills, aches, pain, and nausea and vomiting. The most common side effects of Tarpeyo include high blood pressure, swelling of the lower legs, ankles, and feet, muscle cramps, acne, irritation or inflammation of the skin, weight increase, shortness of breath, swelling of the face, indigestion, tiredness, thicker or more hair on your body and face. These are not all the possible side effects of Tarpeyo. Call your doctor for medical advice about side effects if you feel you are developing them. You may report side effects to the FDA at the number I've already mentioned, which is 1-800-FDA-1088. So in summary, Tarpeyo can help you take control of your IgA nephropathy. Tarpeyo is specifically designed for and studied in IgA nephropathy, and it targets a source of the abnormal IgA that deposits in the filters in your kidney. It targets the gut and the generation of that abnormal IgA. Tarpeyo is designed to deliver treatment to an area of the gut thought to play a role in IgA nephropathy, as I've said, although it has not been established to what extent the efficacy of Tarpeyo is derived from local effects in the gut compared to systemic effects in the circulation. Tarpeyo can reduce the amount of the abnormal IgA1 antibody, with the thought that this reduction will translate to a reduction in IgA1 buildup in the fine filters of the kidneys in IgA nephropathy. Tarpeyo has been shown to reduce the amount of protein in the urine, and it is a once daily oral medication. We encourage you to connect with us and learn more about Tarpeyo by visiting these resources on the screen. Search for Tarpeyo on Facebook. Visit and bookmark tarpeyo.com, and you can see the QR code on your screen at the moment if you want to take a picture and access that directly. So it's been a real pleasure for allowing me to join you today to talk about Tarpeyo, and I hope you found it useful. And I think the future certainly looks very bright for patients with IgA nephropathy. And please investigate Tarpeyo more and find out whether it's a treatment that would be suitable for you by discussing it with your healthcare practitioner. Thank you, and I hope you have a great day.
Thank you, Dr. Barratt, for speaking with us today about an exciting new innovation in treating IgA nephropathy. I'd like to close today's HealthLine Innovator webinar with a few resources from AAKP. If you are not already a member of AAKP, we encourage you to join us. AAKP offers free membership to patients and their family members, as well as living kidney donors. To become a free member, you can join online or by giving us a call on the phone. To receive all the benefits of membership, please be sure to include your email address when signing up. As an AAKP member, you will be notified by email when opportunities arise where your opinions and experiences are needed to help inform innovation, advance care, and make a meaningful impact to improve lives. We encourage you to respond to our flash surveys and other engagement opportunities to help us elevate the patient voice and change the status quo for kidney disease care. You can also select to receive any of our 5 different electronic newsletters and subscribe to our print magazine, AAKP Renal Life. We also invite you to follow us on our blog and social media for all the latest news and announcements. AAKP is dedicated to helping patients understand their condition and take control of their healthcare. We are proud to offer a variety of resources for both patients and caregivers. We also offer numerous kidney-friendly recipes with details on the nutritional content and which stage of kidney disease these recipes are good for. By visiting our website at aakp.org and clicking on the AAKP Store button at the top of the homepage, you can find a variety of educational brochures and online tools to order or download. And you can also order materials by phone. We'd again like to thank Dr. Jonathan Barratt for his time today and to Calliditas Therapeutics for sponsoring this AAKP HealthLine Innovator webinar. Thank you all for joining us today. Be informed and stay safe.